Hi, I'm Guillory. I'm the founder at Root Causes Medicine, and I wanted to talk about people with Parkinson's disease. So if you have a friend or family member or you are struggling with Parkinson's, please go back and watch the introductory video on the framework, how I assess and treat all patients, and then come back and watch this video. You might find the video on the trap as to be beneficial as well. So Parkinson's disease is a devastating neurodegenerative disease, and in conventional medicine we don't have many great options. I have been curious about this disease for a long time, and I treat it quite a bit differently than conventional neurology does. I'm not a neurologist. I want all my patients to have a neurologist, and we disagree obviously on many things, but like all other conditions, two priorities: symptoms and causes. So symptoms in Parkinson's disease are tremor, unsteady, shuffling gait, weakness, among some other things. And so we have to address those symptoms. I address those symptoms with medication. Many times patients come to my practice already on some medications. In some instances, I try to get them off those medications, and many others I don't. And it just depends on the unique individual and what they're valuing and what they're able to do. But for symptom management, particularly with a new diagnosis and in patients who have struggled with the medication, there are some options. And I have had many patients who had no options and who could not walk or talk or have any quality of life, and conventional medicine had no other options for them. And we've gotten them using a protocol. It's called the Mucuna protocol, M-U-C-U-N-A. Mucuna is a seed that we get levodopa from. Levodopa is the immediate precursor to dopamine. And as most people with Parkinson's know, there's a deficiency of dopamine in the certain area of the brain that helps control movement. And so the Mucuna protocol is a very complicated but very effective protocol to help people manage the symptoms of Parkinson's disease. And it's not a cause treatment, but it is a treatment which can prolong the quality of life for many people with Parkinson's. And it can also really give people a quality of life back that they may not have had. And so that's the primary symptom treatment that I use for people with Parkinson's. It requires many visits, weekly visits, because I have to tailor these nutritional supplements, their neurotransmitter support supplements specifically, to the individual. And it requires a weekly exam for many weeks. And this is the reason why the cost for this type of patient is so expensive, because it requires a lot of work. That's symptoms for Parkinson's disease. For causes, in conventional medicine, we've always believed that there really wasn't a known cause of Parkinson's. I have found in my practice that is not true. I have a belief and a clinical experience that many people with Parkinson's have an identifiable cause, and sometimes we can do something about that cause, and that's very individualized, but the causes of disease are the same: deficiency and toxicity. So there are B vitamin deficiencies that can contribute. There are deficiencies in other cofactors, and then there are inflammatory toxicities, environmental toxicities, and infectious toxicities that seem to be related in some people to their diagnoses of Parkinson's. And so that requires some testing. It requires a lot of careful thought, and it requires a team of people working together over time in community to figure out and work out those underlying causes. But I always have a lot of hope for people with Parkinson's because I've seen some dramatic improvements.